Thank you so much for being here. This presentation is for educational use only and presented in the US for US audiences. My name is Karen Yee, and I'm the Global Health Economics and Outcomes Research Director at Alexion AstraZeneca Rare Diseases. And we look forward to a robust discussion on impacts of generalized myasthenia gravis. We'll start with introductions, followed by a brief presentation before we open up for discussion. Here with us today is a patient and co-founder of gMG, Christina Ramirez, and our host, Allison Foss, Executive Director of Myasthenia Association. And now let's dive into the presentation. As many of you know, traditional research does not always reflect what patients really go through. Rare diseases are complex, and it may be hard to fully understand their impact, how they are studied, and to how they impact everyday life. The EveryLife Foundation conducted a study to better understand and describe the economic burden of rare diseases. The goal was to empower the rare disease patient community and advocate for impactful, science-driven legislation and policy. The study started with the known direct medical costs, things such as hospital costs and medication costs, and then added indirect, non-medical, and uncovered healthcare costs. We refer to these hidden costs because they are not always studied or accounted for. Indirect costs include what is often referred to as productivity loss, things like work absences, having to scale back work hours, not performing at their best when at work, or even lost annual earnings from early retirement, all of which may have a drastic impact on one's life. Non-medical and uncovered healthcare costs include payments for things such as transportation required to a neurologist for care, or additional costs for childcare during medical appointments. Things that cost money but do not show up on a medical bill. The EveryLife Foundation found that a total estimated yearly economic impact of rare diseases reached $997 billion in the United States in 2019. We can think of these costs like an iceberg, with known direct medical costs being what we can see at the surface. As is true with icebergs, the largest portion is beneath the surface. That's how it panned out for the cost of rare diseases. The hidden costs, the indirect, the non-medical, uncovered healthcare costs account for more than half of the total. To put this number into context, the total U.S. household energy spending in 2022 was $482 billion. The total economic impact of rare diseases was more than double that amount. These findings reflect the scale of rare diseases impact and the need to bring rare disease to the forefront of the public health agenda. In following up to the EveryLife Foundation study on rare diseases at large, Alexion sponsored research to uncover the total impact of generalized myasthenia gravis specifically. Many rare diseases are not well understood, and experiences vary across different conditions, so we needed an innovative approach to measure the impacts of generalized myasthenia gravis beyond direct medical costs. We know that generalized myasthenia gravis has a substantial financial and occupational impact on patients and caregivers, and we wanted to measure these costs beyond just direct medical costs. The gMG 360 initiative used a mix of approaches to uncover a deeper understanding of the impact of gMG on all who are affected, patients, their families, and society. Our goals were to understand what life with generalized myasthenia gravis is like for those living with it and their care partners, to learn how much gMG affects daily lives from routines to activities, and to measure the economic impact of generalized myasthenia gravis on anyone affected by this disease. In order to understand the direct medical costs for generalized myasthenia patients, we calculated additional costs incurred by people with gMG compared with people without gMG using insurance claims data. The insurance claims data includes more than 16,000 patients across the range of medical insurance types. To understand the hidden costs, which were defined as indirect, non-medical, and uncovered healthcare costs, we surveyed more than 300 patients or caregivers and used publicly available national averages to apply costs to impacts reported in the survey. A steering committee was also included. It consists of patients, patient advocacy representatives, clinicians, and policy experts to help us ensure in scientific rigor and that we appropriately capture the experiences and measure that what is mattered most to the community. Similar to the findings for broader rare diseases in the Every Life Foundation, the hidden costs accounted for more than half of all the costs and were driven by productivity loss. Further, we found that caregivers' costs contribute to an additional $4.3 billion, with most being attributed to informal care, bringing the total economic impact of generalized myasthenia gravis to $13.6 billion in 2022, or approximately the equivalent to a cost of a year's worth of groceries in 2022 for more than 2 million families. We hope that these findings uncover the extensive hidden costs of gMG and help pave the way for prioritizing and improving care and outcomes for the community. While these financial numbers are staggering, we also sought to understand how far-reaching these expenses are. In a survey, 88% of patients reported at least one negative occupational, education, or life opportunity due to generalized myasthenia gravis. And the fluctuating nature of the disease may lead to difficulties with employment. 49% of patients reported working a job for fewer hours due to gMG, and 43% of patients reported missing opportunities for a better job, opportunity, or promotion or benefits. Patients have described generalized myasthenia gravis as an invisible disease, which can have additional far-reaching impacts such as anxiety or feelings of vulnerability and lack of control, which may lead to social isolation, all of which contribute to an overall well-being. We saw similar trends with caregivers as well. The impact was far-reaching, and caregiver hidden costs account for nearly half of the economic impact, yet often overlooked. 7 out of 10 people with generalized myasthenia gravis reported requiring informal care and assistance due to symptoms that make daily tasks for their loved ones more difficult. 72% of caregivers reported at least one negative impact on occupational, educational, or life opportunities due to generalized myasthenia gravis. And we found that unpaid caregivers provide an average of 75 hours of care per week, or an average of almost 11 hours per day, more hours than a full-time job. This is in addition to the 9 hours per week of formal paid caregiving. So I know that was a lot of information, and I hope that you found these results informative and thought-provoking. We hope drawing attention to these hidden costs will lead to more research and advancement for the community. And now we can open it up to Q&A. You can add a Q&A, your questions in the Q&A section. And I'd like to hear from Christina and Allison to understand the findings and how they resonate with them. So with that, I'll stop sharing my screen. I have a question for Christina and Allison about, since your experience in being a part of the steering committee, how are any of these findings surprising or reflect any of your experiences with generalized myasthenia gravis? Christina?
Me first? All right, yeah. They were a little surprising, but then when you really think about it, it wasn't all that shocking. I mean, there's so much that you don't see that happens under the hood in MG. So once you start adding up the costs, like um, whether it's childcare that you didn't expect to pay, plus the missed work, like you said, and driving to and from appointments. I know a lot of people drive 4 or 5 hours to get to their specialist. So, I mean, it adds up. And so at first it's a vast number, but then when you really hone in and you think about what you've spent in however many years since you've been diagnosed, it adds up.
Allison, do you have anything you'd like to add with your experiences?
Sure. So I think, when we talked about this question, as we were finishing up the survey and the study, one thing that came to mind is, the MG space really over the last 10 years has evolved and gotten a lot of attention with the research and things like that. But there really wasn't a survey to compare this to or for us to look at that would show what data was 20 years ago or 25 years ago. So I think it was surprising, but also there wasn't really anything to compare it to. So I feel like the work that we did with the MG360 kind of is it will be a good metric for future surveys.
Yeah, it's a good point.
Thank you. Is there anything from your experience or from the learnings from this survey that you think that physicians or healthcare professionals should know about patients with myasthenia gravis?
Who's me or Allison?
Oh, you can go first, Christina.
Things they need to know. Well, I think they're going to be surprised by a lot of things. I think, for example, one of the items that came up and was shocking to the steering committee was the number of caregiving hours and 70 plus per week. And I remember someone saying, I mean, do we need to re-review these results, see how they were assessed and make sure they're accurate, because that's more than a full-time job. And I thought about it, and I can honestly say I've never talked to one of my providers about how much other people help me. I talk about what I can't do, but not how much other people step in. So, for example, driving my kids to and from school when I couldn't, and cooking when I couldn't, doing laundry when I couldn't, folding clothes, not just helping me with ADLs, but the things that you can't do. And when you add that up, it made sense. In fact, I asked my husband, I remember we were in the meeting and I asked my husband, like, if you factored in this, and this, how many hours a week do you think that you helped me, like in the bad years, the roller coaster years? And I think he said right about 70 hours a week. And so I think that that's probably true for all patients. Doctors, they just don't have the time to have that kind of a conversation. So I think that's going to be really eye-opening. That and the dollar signs, I think, I mean, like you said, it's double the annual household income for rare diseases. So I think I think that's going to stand out.
Interesting.
One thing that I think is just we all need the gentle reminder, and sometimes not only do providers forget, but even from patient to patient, you forget that we are all different. Christina's background has the snowflake, myasthenia gravis is a snowflake disease. And so you can't really put everything in one bucket that people are going to be just alike. And so I think it can be really easy for providers to forget that they might have a really complex patient that every aspect of their life is altered from living with myasthenia gravis. So yeah, I think the data in the survey, I hope it reaches the desks of every clinician, so that they really can get a good view and picture of.
Yeah, and we are so different. And then at the same, also so many times I have morning appointments and I'm at my best, right? But by the end of the day, it's a totally different picture. That happens so much in the first few years when I was on the roller coaster, so much different than now. And I think that's true for a lot of people. And especially, I mean, I don't know about everybody else, but neurologist appointments are often, I'm sitting in the waiting room for a while. So I've rested since getting ready and walking upstairs or, going through the elevator, and I've sat in the lobby and then I get checked in and I got my vitals and I've rested my neck back. And so by the time he does my assessment, I mean, I may not be baseline, but I'm not as bad as I'm going to be in a few hours. So it just timing, I think, I hope that it really does stand out, because what you see in those 15, 20, 30 minutes is not the big picture.
I think one other element that you have to consider is, I think it's no secret that women often bear the burden and take on as many tasks and jobs and chores and everything. And when you go to the neurologist, you're probably not thinking about all those little things, but you do, like Christina just talked about, driving the kids to school and fixing snacks and fixing meals. And it's not like the forefront of what you're going to talk about.
Yeah.
I want to remind everyone that there is a Q&A button on the
Yeah, give us
Zoom.
some questions.
If you have any questions, please add them there and we can answer them. Otherwise, I can keep asking questions to Christina and Allison about this study, which is very eye-opening for us. I really wanted to talk about some of the caregiver perspectives that we were able to pull out of this and their experiences. And I wanted to know, is there anything from the study that were changing your perspective from their experiences? So, Christina, did you want to start?
Yeah. I think it really just highlighted how invisible their burden is. So like it's not talked about. That's one thing, but also it's expected, right? So somebody's going to step in, but what about the people who don't have someone to step in? When you don't have someone to step in, many are forced to hire someone to step in, right? And that's not covered. So whether it is a house cleaner that comes every so often, a dog walker, I mean, I know plenty of patients who have a support animal, but sometimes in our exacerbations, you can't walk. That dog still needs to get some exercise in order to stay a healthy support animal, right? So I think, the caregiving is a need for nearly every MG patient at some point, right? But their burden is invisible to the health community. And I think that above all else, that was shown. I mean, the broader statistics of the whole study, I hope everybody will read it, but it really brought out a lot. We covered just some highlights, but it brought out a lot. And, I I'm grateful for that for sure.
And I think, just to add to what Christina shared, one of the comments that we have heard before as an organization is, caregivers don't necessarily label themselves as a caregiver or that to be their role. And so, they aren't able to verbalize the burden unless you really sit down with them and pick it apart. And that in itself can be detrimental if you're not recognizing that everything that you're doing is caregiving. November is Caregiver Appreciation Month, and a few years ago we did a webinar where we wanted a lot of caregivers to join, and we were having trouble getting people interested in attending. And the wife of an individual that we served living with MG was like, well, I'm married to him. It's my job. So I think hopefully this study also raises awareness of the extra lengths that you have to go when somebody is living with a chronic illness.
Yeah, and another thing too, Allison, is as I think about it, I know plenty, I mean, not plenty, but I know quite a few MG patients, right? I'm connected with them online, in person, we met many times. I've become close friends with many in the MG community. And yet, even still, I mean, somebody even lives a few streets away from me. And she's our age. Even still, my spouse doesn't have a support group or a friend who is also a caregiver. I mean, it's not easy for the caregivers to connect with other caregivers. I think part of it is they already have so much on their plate, it's like a to-do, but also it's uncomfortable, right? I think we as patients start to lean on one another almost because we have to. I think in the beginning, I know I learned more from the MG community than I did from any provider. But I think that that's not the case for caregivers. And I think it's their burden sets in a little bit later. And by then it's already so isolated. And so I hope that this will also highlight the need to do something about that for sure.
Okay, so we're getting some questions from the Q&A. One of these is, did the study calculate loss of retirement income due to job loss or impact on the future income due to reduced hours? This impacts women and men, but also disproportionately affects women more due to their reduced earnings in compared to men. So I can answer this question. As part of the survey, we did ask a question about loss of income due to early retirement. This was calculated very conservatively. So it does only account for patients and caregivers that had retired during the year of 2022. So any loss of earnings due to earlier retirement earlier than 2022, we calculated that and noted it down as a person who had retired early because of generalized myasthenia gravis. But it then outside of 2022 in that year, it gets very difficult to estimate that cost. So it also highlights that the total burden cost that we were able to estimate is quite conservative. Thank you.
There's
And
another question.
yes. So it reads, I've heard countless stories of people with myasthenia gravis, especially women, who were dismissed, invalidated, or told they were fine, quote, by their doctors only to be diagnosed years later. Is there some kind of training that medical professionals go through to become better at listening to patients and validating their experiences? I know that I had my doctor approach things differently, even if they didn't all have all the answers. and just justified what I was telling him. My experience could have been so much easier. Christina, did you want to take this one?
Yeah, so to an extent, yes. Definitely as part of our training. So obviously I was an ICU nurse. But it's the same in medical school. We take into consideration and we're taught about different cultures, about so some cultures you may not have direct eye contact. You might have, women who are going to be more forward than men and others more reserved, um, and also age bracket differentiations. And in that, you do study to some extent communication styles and techniques, right? But what everyone, just like with all of life, what everyone takes from that experience and that portion of your education is unique based on the perspective of what they're receiving during that lecture or that piece of your education, right? So how much are they, I know when I was in those, I would actively like put myself in situations and in my mind and think like, how would I respond if this or that scenario was happening? And I remember even then having some of those scenarios when I was in nursing, and I'd sit down and I would actively practice some of the things that we were taught as like little tricks. But whether or not everyone thinks about it through that extent is what matters. I think that in the last years, we're seeing more about active listening, about patients being, I hate the word, to be honest, gaslit, but it is a reality, right? And about patient gaslighting and about patient satisfaction having to do with the time spent explaining things thoroughly to their provider. So we're seeing that change, but again, it's really about, even if you can do all the CEUs in the world that you want on this topic, but what you take from that has to be universal in order to actually see real change, right? That or assessed in some way through practice. And so I don't think we're there or anywhere near there yet, unfortunately, but hopefully someday. I do think we're shifting. Things are shifting for sure.
Okay. We may not have all the answers to some of your questions, but I will ask this one and see if we do. Can a spouse qualify for government reimbursement for caregiving?
It depends. It depends on the state usually. I don't think there's anything federally. I believe it's per state. So I know I think actually, I don't know, in our state, a mother or a spouse cannot be paid for caregiving for their child, even if they are a nurse. Like actually, now that I think about it, I have a friend who's a nurse and her child needs in-home nursing care, and she cannot be paid for it. So she has to hire a nurse to come and take care of him, and then she goes to work as a nurse to pay for it. So the nurse gets paid a little bit, but I mean some of those hours, but the family cannot. So I think it's more an answer of per state. As far as I know, I don't know any government program that exists like that.
It does vary state by state on whether a family member can provide home care.
Paid hours.
And like I know in the state of Kansas, a sibling can provide it, I think if they're over 16. But definitely check with your state, and you would have to run everything through them.
Anybody else? We had a lot of fun doing this study. It was really, I feel really privileged to have done it for sure, to have had the opportunity to shine a light on these things.
Karen, is there a link that attendees can get to view the whole paper that was written?
There will be soon. So it is submitted for publication. We're going through peer review process right now. So as soon as it is available, we will we will make it, we will have the ability to post it.
It's been a long process, huh? When did we start it? I can't even remember now.
It was, so the survey was started in 2023. So I think in the
Yeah.
spring, yes. And we asked about all the experiences patients and caregivers could have had during the year of 2022. And so that was the perspective that we took in order to calculate those costs over a course of a year.
Mhm. Yeah, it's been quite the journey. Somebody asked about the link to the study. So when the study is, it's under peer review for publication right now. And so once it is made public, we can then post it. And then Karen, there's another one.
Yes. So next steps under consideration. So ours is, we're very focused on getting this information published in a peer-reviewed journal. So that is what we have, but we do utilize the information collected in numerous other studies that we do as inputs from economic models, or any other model where we're trying to show that impact on both patients, but also being able to incorporate the impact on caregivers as well. I don't know, Allison, if you have any next steps under consideration with respect to the study and the findings.
I think one important thing, and there was a question asked, is sharing with our community the study at length, so there's full transparency.
So I have, it's not really a saying so much, but I encourage everybody who is passionate, whether you're somehow either you have MG or you have a loved one with MG, you're here for a reason, right? And a while ago, I wrote something, and it's not polished, so bear with me, but where people underestimate the power of sharing, even just a link. People don't really understand what awareness means, but with sharing, you get awareness. Awareness is education. And with education, people learn things that are needed and that they, as individuals, you never know who you're going to reach, that they have the power to help people directly. With that increased awareness, one person at a time, we can increase attention. That attention gets us funding, and that funding allows organizations to increase research, provide more of these campaigns that provide data. And that data is what's needed for us to get the treatments, to get the changes, to get the coverage that we need. So in terms of next steps, everyone can be a part of next steps. You can all participate in making this matter and get to the people that we need it to get to. Everywhere. Share, share, share.
Karen, I think there's a few more questions that came in.
Yes. So the next question was, was the caregiver information broken down by sex? Was there a difference in estimate of hours of care by caregiver based on sex? There were, it was broken down by sex, and we do have that information as a part of the study. From what I remember, there were, surprisingly, for these types of surveys, a large number of men have actually answered the survey for caregivers. I don't think there were more or less hours broken down that were reported by male
That
or
doesn't
females.
stand out to me either, yeah. I think it was
Yeah,
pretty even.
it was quite even, but I do remember that being,
Don't quote us.
I do remember
It's been
being
a little bit.
quite
There's a lot of numbers
surprised.
in this study.
I was surprised by the number of men that actually completed the survey as a caregiver. So that was
Mhm.
something that did occur. Next question, how could the results of the study translate to specific policies to better support people in our community? So, Allison.
I wish Adrian was here for this. He'd be so great at this question.
I think one way that, we talked about different states have different requirements and rules and regulations for reimbursing caregivers. So, gosh, if there was any way to get it in front of policymakers at the state level in all the states and show them the need, that would be amazing. I come from the world of I worked in social work for people with developmental disabilities, and prior to my job here at the MGA, and there's supportive home care and community-based services for individuals with developmental disabilities where care is reimbursed. So if there was a way to implement similar programs in every state that everybody could qualify for, I think that would be, we could consider that winning.
Yeah, and everybody here has the power to do that and contribute to that too. You can always look up their emails, write a short letter, and attach the information and how it applies to you and what you'd like to see done. It doesn't have to be fancy. I think I was intimidated by that for a really long time, but it really doesn't. You attach the study, you let them know what parts of it apply to you and yours, and what you'd like to see done. You never know what's going to come of it. You never know.
Yeah. So this is not a question, but they are very eager to get this in front of the policymakers at their state. That I am glad that
Yeah,
we'll be able to have this for
absolutely.
you soon.
Thank you
Great.
guys so much. And thank you to you guys, Karen, for putting this on. And it's been eye-opening. I'm really happy to have given a voice to everybody.
See, we were
Not me, but we.
the Myasthenia Gravis Association and myself, we were happy to contribute to this really important topic.
Yep.
And we're very grateful to have your voices in it as well, and your guidance from a patient advocacy and patient perspective. So thank you. And thank you, Allison, and the MGA for allowing us and hosting this webinar and allowing us to share. And thank you to everyone who was participating in this webinar. We very much value your questions. We were here to discuss these impacts of gMG for patients and caregivers. I know there were some additional questions in the chat that might be regarding specific investigational treatments. And so we're not able to cover that in this webinar, but if you do have specific questions, you can send them to Allison or the MGA, and we can make sure we can field your questions as best as we can. Right. And with that, I hope you found this to be empowering and to share more information with your doctors and influence the life and beyond physical and mental health and your understanding of this full impact of this condition in your lives and providing holistic support. So thank you, everyone, and I wish you a very good evening.
Thank you.
Thank you. Thanks, Karen. Thanks, Allison.
Bye-bye.
Bye.